Thank you for joining us right on time. Dr. Pendekar, are you ready to start presenting?
Yeah. Hi, everyone. Welcome. And sorry, I'm not on video today. I'm in clinic, but thank you for joining us today for the Health Plan of San Mateo's dental program webinar. And we have a short agenda today. We're gonna start off with introductions and give you some background on Health Plan of San Mateo and a little bit about the dental integration program development. We'll also talk about what's the benefits of this program for dental clinics, and then share a couple of next steps with you. Next slide, please. So I'm going to start off with introducing myself. I'm Shaklvi Pendurkar. I'm a public health dentist, and I am the dental director consultant for the dental integration project with HPSM. And I'm going to turn over to Marissa, who will introduce herself as well.
Thank you. So my name is Marissa Cardarelli. I'm the dental benefits manager at HPSM. Before I began working here in April, I did work in the dental field for over 13 years, and I have both administrative and clinical experience in a dental office. I'm really excited about starting this program and appreciate you joining us for today.
Thank you, Marissa. So just wanted to share a little bit background information about HPSM with you. We are a local health plan for low-income San Mateo County residents. We serve about 150,000 members, out of which 120,000 Medi-Cal members will be part of the dental integration program. HPSM is governed by the San Mateo Health Commission, and we celebrated our 30 years in 2017. Our vision is healthy is for everyone. Next slide, please. Just wanted to share this slide giving you an idea about the age demographics of our members. We've got about 50% of our members who fall under the 21 age group, and we've got 22 to 64 age group, about 41%, and then 9% who are above 65 years old. Next slide, please. And this slide just goes over the members' race and ethnicities. As you can see, about 46% of our members are Hispanic. We've got 19% Asian or Pacific Islanders members, 14% are Caucasian, 3% Black, and then about 18% who we are not able to identify. The preferred language for 56% of our members is English. Spanish is spoken by 34% of our members, and then there's a mix of other languages, such as Tagalog, Arabic, Portuguese, and Chinese that are spoken by other members as well. HPSM does provide translation services if needed for member services. Next slide, please. Just to give you a bit of an information about the HPSM dental integration program, which this webinar is about. About June 2018, Assembly Bill 1815 talked about the state authorizing a 6-year dental integration pilot in San Mateo County. This required a process for stakeholders to provide their input and for HPSM to develop objectives for utilization and access, and as well as a readiness assessment for the program. At the end of the program, it will also include a formal evaluation by an external entity focusing on utilization of dental services, especially focusing on preventive care, and we will have some information on access to care and impact on medical cost, and such as reduction in emergency room utilization. Next slide, please. So the current state of annual dental visits, as you can see on the slides, for children, the rates are less than 50%, and our program goal is to exceed 60% to increase the preventive and restorative service ratio over time. For the adults, the current rate is less than 25%, and our program goal is to exceed this rate to exceed 40%, and also to increase preventive and restorative service ratio over time. The initial priority for preventive services through this program will be for children ages 0 to 21. Next slide, please. The goals of dental integration is to improve access to care for dental services, especially as I mentioned before, for preventive services. We want to align oral health with overall health. And basically, we want to demonstrate through formal evaluation that integrating medical and dental services is cost effective. So, which means that when we invest in preventive dental care, it would reduce the overall medical care cost, especially for non-traumatic dental emergency room visits, hospital admissions, as well as the cost of diabetic care. Next slide, please. So currently, the way the HPSM members access dental needs is for medical needs, they reach out to HPSM, and we've got 30 plus years of service to our members. For dental needs, however, they have to reach out to Medi-Cal, to dental, or Denti-Cal as we know it. And so they have two different places, one for dental and one for the medical needs. When they try to reach Denti-Cal, oftentimes it could be a longer wait time to actually be able to talk to someone or to get in contact with someone at the state level for Denti-Cal if they have any questions or need to find a provider. Next slide, please. And then what we are proposing and what the future state will be through this dental integration program is that for all HPSM members, they will be able to contact HPSM for both their medical as well as their dental needs. And they will have a person to talk to. They will be able to access dental care, to get a dental provider, get connected to dental providers. If they have any questions related to dental needs, they will be able to pick up the phone, talk to someone at HPSM, and get those questions answered. So it will be one place where they can get both their needs addressed, dental as well as medical, and that will be at HPSM. So it will make it a lot easier for members to access dental care. Next slide, please. And Marissa is going to go over the next few slides and give some background information about the program elements for the dental clinics. Go ahead, Marissa.
All right, thank you, Shakopee. And I'm going to be leaving my video off for now. I'm having some Wi-Fi issues and just want to make sure I can continue sharing my screen. But as she said, right now I'll be going over the program elements for dental clinics and give a brief overview of the program administration. So one of the key values of contracting with us is that we are a local health plan. We work in San Mateo County. Our office is located in South San Francisco, and we have been serving this community for over 30 years. When you contract with us, you will know who we are. We highly value building relationships with providers in our network and making sure that they are getting the most out of working with us and that they're able to care for their patients at the best quality. In addition, we will provide member services and support, and we will also offer referral coordination for when your patients need to see a specialist with help from our dental access and referral coordinators, which I will go into more detail about in another slide. In addition, we also have a local dental advisory that has helped us plan every step of the way, and we are very eager to see the value in integrating medical and dental benefits for our members to improve their overall health and ensure that they have the best access. So now we'll be going over important program elements. The first one is about payment. So HPSM will pay 130% of the Denti-Cal fee schedule for all covered benefits. Also, any payments pertaining to Prop 56 are in addition to this payment, and we will make no initial changes to the covered benefits, but there will be no annual maximum for our members. Authorizations. For authorizations, HPSM has reduced the number of services that will require an authorization compared to Medi-Cal Dental. None of the 30 most frequently billed codes will require an authorization, and those that do are the high cost and have complex benefit restrictions like major services. One change we have implemented is no longer requiring an authorization for the service of deep cleanings or SRPs, which we're hoping will open the doors for more adults to get the care that they need that has been not given to them in the past. And another benefit is that our average turnaround time for these authorizations for the major services will be less than 5 days. For claims payment, just as our authorizations have a quick turnaround time, our claims payments do as well. On the medical side, HPSM pays 98% of their claims within 30 days, and when a complete claim is sent electronically, you will receive payment within 14 days. And now about your participation options. This is another key benefit is that when you contract with us, you are in control of how you want to participate. You can be open to all new HPSM patients. You can limit the patients you see by age, for example, under age 18, or you can accept just a certain amount of new patients a month. And lastly, you can be listed as not accepting new patients, and a member will be instructed to call HPSM for provider availability. Now, this just gives us a visual representation of the options for dental clinic participation. As I stated before, you could be open to new patients and members will be able to call you directly. You can be existing patients only. And if a member does, for some reason, want to see you as a provider, they would be instructed to call us and we would call you and ask if you would be able to accept a new patient. And again, this can be changed on an ongoing basis. And then, as I mentioned, the access and referral coordinators earlier, I'll now go over how the process will work when you have a patient that does need to see a specialist. The primary dentist office will make a referral through HPSM. Our staff will verify benefits and availability of requested dental specialist. HPSM staff will contact dental offices based on availability and type of service. And lastly, our HPSM staff will verify referral and with the member and assist with scheduling if necessary. And now I'm going to hand it back to Shakopee, and she's going to go over some of the sample program metrics.
Thank you, Marissa. So one of the goals is to track metrics to this program. And during our first year, we are going to focus on access to dental care. We are going to also focus on baseline member satisfaction, as well as baseline provider satisfaction. And then we are going to try to get some metrics on baseline caries risk assessment. Year 2 will be focusing on improvement in access, improvement in member satisfaction, increase in the number of caries risk assessment, as well as improvement in provider satisfaction. Years 3 to 6, we will be focusing on metrics related to improvement in access, improvement in member satisfaction, caries reduction in children, improvement in provider satisfaction. We want to track metrics related to diabetic control with and without dental care, as well as hypertension control. And we want to see what is the emergency room utilization for non-traumatic dental diagnosis and how the program has affected reduction in those numbers as well. Next slide, please. So some of the next steps that we would like to share with you is the timeline that we've worked on. We have contacted existing dental providers in the county as well as neighboring counties. We have been talking to and have held webinars with the dental societies, with San Mateo, Santa Clara, as well as Mid-Peninsula and San Francisco dental societies. The contract packets are still in process of being reviewed by the state, but should be available soon. And then, as you can see, in September, we will be providing an initial provider network list to the state, which will be followed by an updated list to the state in November of this year. Member outreach will continue through October, November, and December of this year. And then our go live date is January of 2022. Next slide, please. And I'd like to share the information for contacting Marissa. So if you wanted to sign up for the roster, please feel free to contact Marissa at the email address or the phone number that's listed on there, and she will be able to help you further. Next slide, please.
That's the last slide.
Okay, yes. So I just wanted to, as we end the presentation and before we go into Q&A, just wanted to sort of summarize what this program is and how it would benefit providers who are joining us today. You can think about it in two ways. One is providers who are already seeing Medi-Cal dental patients in their offices. And then there are other providers who have never tried out being a provider for Medi-Cal dental patients because of, mostly reasons of poor reimbursement or because of the tedious claims process. So the dental integration program with HPSM will be beneficial because, as Marissa mentioned earlier, you will have one place for all your claims. You talk to HPSM, and all your claims will go through HPSM for any of the medical dental patients that you may serve. The reimbursement rates are going to be higher than what medical dental pays currently. It's going to be for the most common codes that you use in your dental offices. For the preventive codes, your reimbursement is going to be higher through this program. There will be no pre-authorization for the most common 30 codes that are commonly used in dental offices, and most of them falling within preventive services. So you don't have to, for example, pre-authorize scaling root planing. If you see a patient in your office and they need to get a SRP done, you can go ahead and do the SRP. Of course, you'll have documentation in the patient's record as far as the periodontal charting, the radiographs, and why you are performing that service. But you won't have that additional wait time of going through pre-authorization and waiting for medical dental to authorize the treatment. In this case, there's scaling and root planing. So that is ease of services. It's better for your patients, it's better for your practice. And really the claims process, as I said before, and Marissa mentioned before, is because it goes through HPSM, you are not going to be waiting for a long time to hear back from medical dental whether or not your claim has been processed and whether or not you're going to get paid on time. There will be a local person to contact if you have any questions or concerns. The patients that you sign up, you have a choice in how many patients you can add on. So if you have a practice and have capacity for taking on even a couple of patients a year, that's going to go a long way. And if you're not satisfied with the patient, if you don't want to see them anymore, you can always contact HPSM and let us know what the issues are and work with us. And you're not tied into seeing the patient forever. One of the other questions that came up at one of the webinars was whether you'd have to see all Denti-Cal patients. And that's not the case. You would be seeing HPSM patients only. So they are only limited to the 120,000 or so medical dental patients who are served by HPSM. And with that, we will open up for Q&A. So if you have a question, please feel free to unmute yourself and ask. Thank you.
Hi, Shakopee. This is Bonnie from Bonnie G from Some Research Dental Health. Hi, great presentation, Marissa and Shakopee. I had a question. We are seeing Medi-Cal patients right now, and but I believe we are not able to see Medi-Cal Kaiser patients. And I was wondering if there's a distinction when HPSM takes integrates everything. Will that include the Medi-Cal Kaiser patients, or will it be the same where they're separate?
I think Pat is probably on this call. Pat, if you're still on the call, would you be able to answer that for Bonnie, please?
Sure. Hi, Bonnie.
Okay.
I'm actually surprised that you can't see them now because our understanding is Kaiser doesn't offer dental services, but they are through HPSM. So my understanding is Kaiser members will be a part of this program just like everyone else.
Okay, that's good to know, because I just had a staff meeting yesterday where one of the coordinators had confirmed that before I asked, just in case. And I don't know if that was just for sedation cases for the kids that we see, or if it was in general. So I could also clarify that.
We can follow up with the state too, but I'm pretty certain in saying that because Kaiser members have full Medi-Cal benefits and that includes dental, and Kaiser doesn't offer dental services. So yeah, they'll be absolutely a part of it.
Okay, great. Thank you. If nobody else has a question, I'll ask another one.
Go ahead, Bonnie.
Okay, thank you. I heard something about possibly, I think the CalAIM initiative adding Carrie's risk assessment CRA bundle and SDF as new dental benefits beginning January. And I've heard just kind of things tossed around, so I don't know much about it in regards to details, but somebody had mentioned that, oh, that covers a screening, like say a free dental screening in a school-based setting. And I don't know, I read parts of it, but I'm not sure if that indeed would be a screening or if it's more like a Canberra risk assessment where you interview the parent, because usually at a screening, at school screenings, you don't have the parents there to ask the questions for the risk assessment. So I didn't know if this was a different definition of that, like a totally different thing, or if that's something that, you know, if it's something that could be done with or without the parent present.
So, Bonnie, as far as we know, the caries risk assessment codes will still be paid in conjunction with other codes. So, to answer your question about whether those codes can be billed for just for a oral screening, I would think that that's not the case, but we can definitely find out more for you. But my understanding is the caries risk assessment codes will still be and need to be billed in conjunction with like an exam or pro fee, that type of thing. It's not just it's not a billable code in and of itself.
Thank you. That's helpful. So it's not like a standalone code.
I don't think so, but again, we can check more and get back to you on that.
Okay, thank you. It says, and CRA or Caries Risk Assessment, would that still, is the definition still like, you know, a quick survey with the parent asking questions, and then based on the answers to that determines the child's risk level?
Yeah, so usually like in a clinical setting, you'd say, for example, you have a child who comes in for either an exam or a recall exam. You'd go through the questions, and typically, yes, in case of children, it would be a parent or caregiver who would answer them. Mm-hmm. And so then when you're doing you're writing your notes for your exam or your recall exam, you would also, you know, there'd be an attached diagnostic code for the caries risk, whether it is low, medium, or high, mm-hmm. and that's how it would be. It would work.
Okay, thank you.
Does that make sense?
Yes, yes, definitely. Okay. Thank you.
Thank you.
This sounds very exciting because everything you've mentioned in the presentation addresses many, if not most, of the concerns that I encounter, you know, working with Medi-Cal, and these would help greatly. So I'm very much looking forward to you all taking over in January.
Thank you, Bonnie, and thanks for joining us today. And thanks to everyone who's joining today during the lunch hour and taking time away from patients. We really appreciate it. And I know there are some other dentists who are joining today. If you have any questions, please let us know. We are happy to answer. You know, feel free to unmute yourself and ask, or if you have a comment to share, that'd be great too.
And also feel free, if you'd like to talk offline, you could send me an email at thedental@hpsm, or also give me a call. If you know any other providers that might be interested in this, also please give them our email. I'd be happy to set up a one-on-one with you or any other providers that you know. I'm going to really appreciate your time today and hope that you will want to join our network, or if you have any questions, please feel free to reach out to me at dental@hpsm.org.
Thanks, Marissa. I do want to bring up another point. So if anyone who's attending today, you know, is already seeing a Medi-Cal dental patients, and if those happen to be practicing in San Mateo County, then come January, you know, you'd have to, those claims would have to go through HPSM. So if you were to file the claim for an HPSM member, and if you were to send it to THCS, then it's very likely that that claim is not going to get reimbursed. So in other words, if you are practicing within San Mateo County and seeing Medi-Cal dental patients right now, if come January, if that member is an HPSM member, then your claims would have to go through HPSM, and for that you'd have to sign up with HPSM as a dental provider. So that's why we have these webinars now, to give information and give you enough time so that, you know, you can talk to Marissa, get the roster signed up and join the network. For those who have never seen Medi-Cal dental patients in their practices, again, this is a great opportunity to try it out. You're going to get paid more than what Medi-Cal pays right now. You're going to have quicker claims reimbursement. You're going to have no need for pre-authorization for the most common codes that services that you provide in your office. You will have a local person to talk to if you have any questions or concerns. Again, you have a choice of how many patients to take on or what age group of patients to take on, and you always have the opportunity to drop off if it doesn't work out for you. So if you've never tried it and have the capacity in your dental offices to see a few more patients, then I would strongly urge you to do this. Plus, it's a great opportunity for those of us who are dentists attending this webinar today. It's a great opportunity for us to really see how an integrated program would work, where you are integrating dental with medical. And we've always talked about this and how dental should be part of the whole health package, and this would be a great opportunity to test that. So, thank you.
Yes, thanks for adding that, Shakopee. Again, just our email is dental@hpsm.org, so please feel free to reach out. And we will end a little bit early today. And thank you again for your time, and have a great day.